So the question here from Robin, it's a good one. It came up earlier today, actually at the beginning of Rehab Power Hour. So I apologize, Robin, I forgot about it. So will the Motus hand help the finger movements of individual, or I guess help individual finger movements? Okay, so good one. When it comes to specifically from the clinical trials, whether or not we looked at interdigitated finger movements, that was not done. I think when it comes to evaluating individual finger ranges of motion, those sort of things, we didn't really do that. What we did is we looked at bulk tone, bulk ranges of motion from the wrist and the fingers, these sorts of things, being able to close and open. But we can know from the outcome measures that I was talking earlier about, we can infer that the interdigitated finger movements are improving because the functions that are required to use those interdigitated finger movements are also improving. Being able to pick up very small blocks. There is this test that's called the Action Research Arm Test, or the ARAT. So if there's any clinicians or anyone familiar with these tests, you'll know that that whole purpose is to do fine object manipulation and move those objects to different locations. So this is a combination of being able to manipulate fine objects and move your arm on block. And so after the interventions, we did see improvements in those capacities. And so we can infer that the individual finger movements were improving. And again, that just makes a lot of sense because the way the muscles that we're working on and the motor networks we're working on are the same ones that actually work interdigitated finger movements as well as the whole wrist and the hand movements. So hopefully, Robin, that was able to answer your question about the actual movements there.